One of the top things that gets asked about all-on-4 dental implants is how much do they cost? And there's actually a lot of factors that get played into that. We have Dr. Hendricks here who's going to tell us the top 10 cost influencers on all-on-4 dental implants.
So the first factor is geographic location. If you're in New York City or Miami, Chicago, some of these places that maybe have higher cost of living, you're gonna have a higher price in any dental treatment. Geographically, if there's lots of dentists, then you're gonna have a lower price in any dental treatment also. The price difference could vary anywhere from $20,000 to $40,000 if you're doing top and bottom, just based off the geography. Traditionally, there's been a surgeon that does the surgery. That's considered phase 1. And then phase 2 is basically having a general doctor, either a prosthodontist or a general dentist, do the restorative work or building the final device. Let me just tell you a different scenario, and this is a scenario that's going to be a lot less expensive, and that is if you have one doctor from start to finish the whole procedure. This is a doctor that has been trained in doing dental implants, who also has the training in making the devices. And if I was to go even one step further, in our office, we actually have the lab technicians here in our office too. So that's like the dream team, when you could have one doctor that actually owns the lab and so is controlling all those forces. All dentists have a good heart, they mean to do well, but it always goes back to how much experience that person has. Even if you have the biggest heart in the world, it doesn't compensate for good old-fashioned experience. There's only a few doctors that can do that level of quality of care in general dentistry and can also spend the time to get the education and the experience in doing full mouth implant dentistry for all-on-4. Each patient has their own needs, and so it's really kind of difficult to say, well, how many implants do I need, or what type of implants are you going to use? That's why we have to see you. We got to take a 3D image. We got to see how your lips move, what your skeletal parameters are, and if you take all this into account, then it's easier to get a precise number. Most dentists have to send their lab work outside of their office. Sometimes they'll send them to labs that aren't very experienced and they don't use really great materials. The biggest factor in this is lab costs. A really great lab is going to have some sort of warranty that goes behind the bridge or device. When you choose an office based off of solely just price, and they choose a lab that's outside of the United States or outside of the state they're working in, now the timeline changes dramatically. The number one reason people come and see me is cosmetics. Second thing is I want to be able to chew and eat my food. The third thing is I'm in pain. The fourth thing is I am just so tired of spending money on dentistry. So depending on what 4 reasons people give me, that really dictates which device I'm going to suggest. There are a lot of different materials. If I was to start at the cheapest and work our way up, we have an all acrylic device that has no substructure in it besides acrylic. The next up from that might be some type of resin bar to go underneath the teeth. One's called Trinia. It's like a fiberglass resin. And again, that would be cheaper than, say, the next one up from that, which would be a Trilor or a pectin substructure. And then above that would be a titanium substructure. And if we were to go one more above that, now we go into a zirconia substructure. They all can look beautiful. The reason why you choose to go for a zirconia, or like a Mercedes in a sense, you're looking for long-term investment, what's gonna last the longest. Okay, so there's really kind of 3 different tiers here. On the base level, you basically have local anesthesia. It's just numbing and you're awake 100% for the procedure. The next level up from that, IV sedation, or sometimes I'll do oral sedation. I would lump that into the same amount. These surgeries can be sometimes 2 to 3, sometimes 4 hours long. And so we actually elect for the third option, which is general anesthesia. In general anesthesia, that's where we actually bring in a third person, a medical anesthesiologist. He literally is keeping you 100% asleep the whole time. The first one would probably be something like where you're a smoker, a patient that's super unhealthy, maybe a diabetic but uncontrolled. if they've never brushed their teeth ever in their life, patients that have heart conditions, when we look at it overall, what's the chance this patient's going to heal? What's the chance I'm gonna have to go back and do this procedure twice? If it's an easy case with less risk factors, then the price would be lower. When I have someone that has more risk factors, I'm going to perform a surgery differently. And when I perform that surgery differently, I may do different techniques. There's some patients that I have to do sinus grafting on. We may have to do a full sinus lift to get it out of the way, which really does increase a lot of time in the surgery. And so we will adjust our fees to accommodate that time. And that's why some doctors will raise their fees quite a bit if they have to do extra techniques. For most offices that don't do this often, it's going to be somewhere between 6 months and a year. Because you're sending your lab work out and back, getting modifications, it would take more time. If you are able to have your own lab with the right equipment, with the right talent, literally you can go through this whole process in a week. So on Monday we do our surgeries. On Fridays we seat our devices. On that following Monday we're going to check the bite and then our patients can fly home. Everyone always wants to know real numbers. And I think that the last video that we did, we got a good response, but we did get some feedback saying, okay, yeah, that's all great, doctor, but can you be more specific? Why don't you throw some numbers out? On the low end, if you are someone that is in a denture, that has low risk factors, that's willing to travel, if you look at all the 10 factors we looked at, your cost per arch could be around 15 grand. Why would it be more expensive? In areas where the cost of living is super high, you have a very high cosmetic demand, meaning that your teeth are already look pretty good, but you want them even better, so you want lots of you want porcelain on top of the zirconia, and you want to have gums that are specifically shaded to match, and you want to see it multiple times. Lots of risk factors, high smile line, maybe you need zygoma implants. This is someone where the cost of the all-on-4 dental implants could start at anywhere from $27,000 to $35,000, maybe even $40,000. You basically have a range is somewhere between 15 at the lowest and up to, I would say, 35 to 40 at the highest. I would say an average price for Dream Dental per arch, meaning for just the top or just the bottom, would be somewhere between 20 and 22. I'd say it was a pretty standard price. It could go as little as 15 if you pick a titanium supported device, and it could be upward of 25 to 27 if you decide to go with zirconia.
If you have any more questions or if you're interested in this procedure yourself, you can book a free consultation with us that includes the free 3D CT scan, which you can see how important they are now. And you can contact us by calling us or filling out the form on our website, and we'll reach out to you.